Surgical instruments, cleaning and bin packing. Why are surgical instruments cleaned? This is to avoid toxic anterior segment syndrome and infection. Because ophthalmic instruments have an important role in the delivery of eye care, instruments are very delicate and require special care. There are two methods of instruments cleaning. Instrument cleaning at end of the day by means of ultrasonic cleaning, instrument cleaning at in between surgeries by means manual cleaning. Materials required for instruments cleaning are ultrasonic cleaner, stainless steel basin, filterized RO water, soft toothbrush, 10 ml 5 ml syringes, hand towel, dryer, tips for sharp instruments and sterile gloves. Before putting instruments in ultrasonic cleaner, it should be segregated as blunt instruments, sharp instruments, cannulated instruments, needles and phaco tips. Instruments cleaning at end of the day, that is by manual and ultrasonic cleaning. Before washing instruments, wash hands thoroughly and wear OT dress with cap and mask and gloves. Instruments washing room should be cleaned and air conditioned. Before putting into ultrasonic cleaner, all instruments should be washed in separate basins. Ultrasonic cleaning. Before putting instruments into ultrasonic cleaner should be cleaned thoroughly, then filled it with correct amount of water because it should not be overfilled or underfilled. To check the working status of ultrasonic cleaner, put a aluminium foil paper inside it and keep it on for 3 minutes. Because due to the ultrasonic vibrations, the aluminium foil paper affected and it gets pores if it is functioning well. So after 3 minutes, check the aluminium foil paper whether pores are present or not. If pores are present means the ultrasonic machine is working properly. After checking the function of this machine, drain all water out and again refill it with correct amount of filterized RO water. Then keep the segregated instrument trays inside it. Keep the instruments inside it and switched on for 3 minutes. After finishing 3 minutes, take the instruments tray carefully because sharp instruments will be there. Every cycle we should change the water. Like this we have to wash Simcoe cannula, phaco tips and all instruments. Then comes instruments washing methods. Wash instruments in 3 basins filled with filterized RO water. In first basin, instrument should be cleaned with soft toothbrush and then washed it with other 2 basins. Then keep it in a clean sterile towel. Then dry it with the clean towel and keep the instruments separately. Anyway, these instruments might be wet, so dry it with dryer. After drying, the sharp instruments tips should be covered by IV cannula tips. Then coming washing of phaco tips, sleeves, chamber, irrigation aspiration tips. Wash each cannulated instrument with 50 cc of RO water. That is, by using 10 ml syringe, flush 10 ml of water inside the cannulated instrument for 5 times. Then washing of Simcoe cannula. It has irrigation and aspiration port separately. So each port should be washed separately with 50 cc of RO water. That is, by using 10 ml syringe, 10 cc of water flushed in each side port for 5 times and dry it with compressed air. Next, washing of hydrocannula. Hydrocannula also washed with filtered RO water by using 5 cc syringe twice a time and dry it with compressed air. Next comes washing of phaco handpiece and irrigation aspiration handpiece. First, the irrigation aspiration handpiece, flush both the irrigation and aspiration ports 10 times with the 20 cc syringe which was filled with the RO water. Then repeat with the syringe filled with air. Washing of phaco handpiece, it has irrigation and aspiration ports. So, irrigation port washed by flushing of filtrate water and aspiration port washed by aspiration of filtrate water. After washing, those cannulated instruments like Simcoe cannula, phaco tips, chambers, sleeves, all should be dried with the dryer. Then, before bin packing, all instruments should be segregated according to the surgery like phaco or SACS, and class 1 indicator should be kept in each trace. Then comes bin packing. Before bin packing, thoroughly clean the bin first, then keep the class 1 indicator over the towel, then keep the trays in a perpendicular alignment, that is in opposite direction. Keep the class 1 indicator in top, middle and bottom of the bin. Don't do tight packing. Loose packing only allows the steam to spread inside the instruments. Keep the class 5 indicator at the middle of the bin. Don't keep sharp instruments at the bottom of the bin. Keep those instruments at the top and cover all the instruments bin with towel and keep the class 1 and class 5 indicator and pack it. The indicators having loading sister name, date of sterilization and expiry date. Instruments cleaning in between surgeries by manual cleaning only. Here the used instruments received from OT. In between surgeries, the knives, visco cannula like disposable instruments should be disposed. Then wash one set of instrument in one basin of RO water. Then instrument tray should be washed in separate bin of water. That cannulated instrument should be washed separately with using syringes. Sharp instruments should be washed carefully. Open the lock and wash the scissors. Take 5 ml of syringe and wash the Simcoe cannula, Vectis and dry it with air. Then keep the washed instruments in separate tray. Then the washed instrument set should be kept in a bin in perpendicular alignment and keep the class 1 indicator in each tray. That indicator should contain autoclave name, sister name, sterile date, expiry date and the load number. Check all and close the bin. Then keep class 1 and class 5 indicator in each bin. Before keeping the bin into the autoclave machine, check the bins whether all holes are opened and open it and keep the bins into the autoclave machine. Then close the door tightly and check the settings and start the machine. Corrosion and rust. Mainly it is caused by tissue debris and salts from the saline irrigating solution which may collect and cause permanent damage. Inadequate cleaning, rinsing and drying also cause damage, and using tap water, a malfunctioning autoclave also cause corrosion and rust. So, cleaning must be done immediately after each surgical procedure. Conclusion: thorough cleaning of instruments, bin packing and sterilization is very important to prevent post-operative infection. Thank you.